Hello and welcome to another episode of Voice for Lungs. Today we have with us Dr. Sai Vivek. Hi, Doctor. Thank you so much for joining us. So, I want to start by asking you what exactly got you into this profession and what do you specialize in?
I think somewhere along the way of our medical journey from MBBS to MD, we tend to get exposed to different departments. And based on what we are looking for, oncology is one department where you need to have a sound knowledge of all the organs of the body. And different people have different patient tolerance and empathy. All doctors need to have empathy, but if you feel you really want to connect with a patient, I don't think there's any other department where there's so much of connection between a patient and a doctor, and the journey is long. So I think that drove me towards oncology, where I thought I could help a lot more people.
So, talking about lung cancer treatment, when is surgery considered for lung cancer treatment?
So, as with any cancer, lung cancer is also differentiated into different stages based on when we detect the person. So, if it's localized, the tumor is localized only to one part of the lung and not spread anywhere, we could put it in stage 1 and stage 2. If it has spread slightly beyond the lungs to the lymph nodes which are present in between the lungs, it becomes stage 3. So surgery is usually preferred in stage 1, 2 and early stage 3. And once we go beyond the lungs, the cancer has started in the lungs and gone to other organs, then surgery doesn't become an option and medical management becomes the treatment of choice.
Okay. What is radiation therapy and when is that used for treatment?
So radiation therapy is basically focusing a high energy source to a particular organ or to particular location. So they map it and then they use this source to hit that particular area. So photons are the energy source that are used, and radiation is used in various settings in lung cancer. In stage 3, it is used as a curative modality. We tend to avoid surgery and give radiation as a curative modality in stage 3. And in stage 4, it is used to reduce the pain of the spread of cancer. If the cancer has spread to the bones, radiation is given to control the pain. So in stage 3 as a curative modality, in stage 4 usually as a palliative modality.
How does chemotherapy work for lung cancer treatment?
So chemotherapy, like how it works in every other cancer, is the same mechanism in lung cancer. Just to make it in a very simple way, chemotherapy is not smart. It's basically a chemical given in a bottle of glucose. So it really cannot differentiate between good cells and bad cells. All that it is designed to do is to kill all fast replicating cells. So we are basing this under the assumption that cancer cells grow much faster than the other body cells. Hence, chemotherapy is able to go inside the body through the intravenous route and go to all the locations where there are fast replicating cells and hence cause destruction of those particular cells. This again is the reason why chemotherapy is associated with side effects also. So if I come from head to toe, the fast replicating cells in our body are the hair cells. So chemotherapy thinks they're the bad cells too. So it hits the hair cells. Coming down, it hits the skin in the mouth, the skin in the throat, hence causing nausea and slight vomiting sensation. And it hits the skin in the stomach and intestines too, hence causing diarrhea. And our blood cells are one of the most fast replicating cells in our body. Hence, it can reduce our immune cells and cause infections. So the effects of chemotherapy are because it can detect fast replicating cells. So are the side effects.
So, what is targeted therapy and how is that used for lung cancer treatment?
So I think, we have laid the foundation with chemotherapy. Chemotherapy is not a smart medicine, kills all fast replicating cells. Targeted therapy in the last 2 decades has really changed the face of lung cancer treatment. So in targeted therapy, using certain advanced diagnostic methodologies, we tend to detect certain changes in the DNA. All of us are born with DNA. We have 2 chromosomes which have genes, and these particular genes undergo alterations in around 50% of lung cancer patients. So we test the genes and look for these changes. So if we find a particular change in lung cancer in a particular patient, there can be a tablet which is given to target that particular gene. Since we are targeting one change in the human DNA, it's called targeted therapy. Okay. So it need not be only DNA. The changes can be in the level of protein also. So targeted therapy is where you detect one particular change and use that as a homing beacon to send a molecule to attack that cell. So this again explains why the adverse events or side effects are much lesser with targeted therapy compared to chemotherapy, because it doesn't have other off-target effects as much as chemotherapy.
Could you please explain immunotherapy and its use in lung cancer treatment?
Yes. So I think in the last 5 to 6 years, immunotherapy has come up in all the available cancers in our body, and especially lung cancer is like the poster boy for immunotherapy. So this has a unique method of working. As we just discussed, cancer is something which hasn't come from outside. It is basically our cells going rogue. So our body inherently has a control mechanism where it tells a particular cell, you are supposed to replicate in this time period. You're not supposed to replicate in between. But when this mechanism is lost and the cells replicate without our control, the word cancer is used. So now when they start replicating without control, ideally speaking, we have the defense mechanism of our immunity fighting this and then stopping the replication. But cancer, being as smart as it is, it secretes certain decoy proteins which tells our own body's immunity, don't fight me, I'm not going to harm you. So immunotherapy is basically again a form of targeted therapy where we are giving injections once in a couple of weeks or 3 weeks, and we hit these decoy proteins. So thereby reactivating our own immune system to fight cancer. So directly it doesn't do anything. In certain individuals, we are successful in activating their own T cells. We have T cells and B cells in our immune system. So the T cells are activated, and these T cells in turn go and fight cancer. So the adverse events are very minimal, even lesser than conventional chemotherapy or targeted therapy. And the duration of response, once our immunity is stimulated enough, the control of cancer tends to be for much longer compared to other modalities of treatment. So that actually summarizes the 3 modalities we as medical oncologists use to treat lung cancer. That is chemotherapy, targeted therapy, and immunotherapy.
So what is palliative care and when is it considered for lung cancer treatment?
So palliative care is basically something which goes in hand with the treatment also in all stage 4 cancer patients. So basically you have a stage 4 cancer patient. That particular patient might have metastasis or spread to the bone or spread to the liver or spread to different organs, and each area where the cancer has spread can have a problem arising, and that can be in terms of pain. If it's a bone spread, the patient might come with pain. If it is spread to the liver or the intestines, nausea, vomiting. Palliative care is nothing but treating the symptoms arising from the cancer and not treating the cancer itself. This can be in terms of social support. So a diagnosis of cancer itself is a shock to many people. So you counseling the patient and making them accept the diagnosis, that is also part of palliative care. Taking care of their pain and taking care of their nutrition, taking care of their day-to-day activities, how they're able to rehabilitate themselves. All these form components of palliative care. It's not either treatment or palliative care in stage 4. Both of them have to go hand in hand. But in certain individuals like elderly individuals or people who have failed multiple types of treatment, where we feel treating is going to harm more than benefiting the patient, we tend to say, let's not treat anymore. We are going to go with only palliative care so that the quality of life is maintained for however long the patient can take it.
What message would you like to convey to our audience regarding lung cancer awareness?
So I think the only way we can beat lung cancer is awareness, awareness, awareness. Why we are lagging behind the Western world is not because of lack of medicines. Literally every medicine that is available in a developed country is available here at actually 1/10 the cost. Nobody will believe it, but it's actually 1/10 the cost in our country. But we start off as doctors with a handicap. Our patients are not aware of it, and they tend to present to us in stage 3 and stage 4. 70% present in stage 3 and stage 4, in contrary to the Western world where 70% probably would present in stage 1 and 2. So the survival is definitely going to be hampered there. So everybody who's probably wanting to know about lung cancer should realize that lung cancer is broadly divided into 2 wings. So one is the non-small cell and one is the small cell. Small cell is exclusively seen 90% of the time in smokers. Non-small cell again has adenocarcinoma and squamous carcinoma. Squamous is smoking related. Why I'm talking about this is adenocarcinoma can be seen in non-smokers. There is almost 20 to 30% of lung cancer patients in the world right now who have never touched a cigarette, have no nicotine exposure. So the myth that only if you smoke will you get lung cancer, if you're not a smoker, you don't have to go for checkups, is actually wrong.
But the chances are higher.
Exactly. I was just coming to that. The person who has history of smoking has a higher chance of getting it. Doesn't mean people who don't smoke can't get it. And people who themselves know that they have a history of long-term smoking, let's say a pack a day for around 20 to 30 years, they form the highest risk group. And these people are eligible to get a low-dose CT scan done once in a year and visit their pulmonologist or an oncologist or even a physician. That would help us pick up these cancers in stage 1 and stage 2, where with minimal treatment, we are able to cure 8 to 9 out of 10. I'm talking about cure. So that is where awareness is very important. Smoking, yes, it's a completely different field. How do you prevent people from smoking? But once you're a smoker, you at least should be able to take care of yourself and visit the doctor and say, see, I have a history of smoking. How do I screen for lung cancer? A simple CT scan. With COVID, that was a big advantage. Because people were getting CT scans for COVID infections, we could pick up multiple early lung cancers and cure them, obviously. So awareness about the symptoms is one more thing. So the main symptoms are cough, which does not go away in spite of treatment. Let's say you have a cough today and you take an antibiotic, it goes away, that's the end of it. But cough, which is not going away for 2 weeks, 3 weeks, is a red flag. It could be a chronic infection like tuberculosis in our country, or it could have something to do with cancer. So that's when you don't leave it at that and continue taking cough syrups. Visit and get a simple CT scan. That will solve the problem. Other symptoms again are breathlessness, chest pain. Then you can have some blood in the sputum. These are subtle signs the body is trying to give you that something is wrong. Picking on them and then getting to a hospital where adequate diagnosis can be done can make the difference between 90% survival versus 50% survival.
Would you recommend smokers to undergo yearly screenings? And is it ever too late to quit smoking?
So I think I'll answer this in parts. The first one, as I was just mentioning, smokers are at a higher risk of developing lung cancer, almost 10 to 13 times at a higher risk than a non-smoker to develop lung cancer. So if he's sure that he has been smoking for a longer than 15 to 20 years, almost a pack, actually that's just a arbitrary mark. So anybody above the age of 45 or 50 who has a significant smoking history of 10 to 15 years of at least a pack can undergo a low-dose CT. You might find on the internet that only people who have taken it for 25 years, 30 years, and above the age of 55 should get it done. In India, what we are noticing is all cancers are coming a decade earlier than what they're coming in the West. So we can't strictly follow the Western guidelines. We have to incorporate them for our country. So I would say 40 to 55 also should be included in this, with a significant smoking history, can get a low-dose CT done once a year. And why the Western guidelines will have lesser people getting screened is because most of the scans there are paid by the insurance or the government. Here, most of our patients pay out of pocket. So a 4,000 rupee or a 5,000 rupee scan once a year, when you know you're a smoker and you're at a higher risk, is still worth the price you can pay to detect the cancer early. And the minute lung cancer is detected, I would say quit smoking right now. But it's never too late. Once cancer is detected, smoking adversely affects the treatment efficiency. So if you're a smoker, chemotherapy is not going to work as well as it would in you. Targeted therapy would be a no-no. Immunotherapy also would be less efficacious if you're continuous to smoke. So as a part of our treatment, if a person is a current smoker, help to cessate smoking or help to quit smoking is one of the treatments that we recommend. We have to address that problem also. The reason being, we will be able to cure the cancer, let's say in the right side of the lung if we treat him. If he continues to smoke, there is no reason why he can't develop a cancer in the left lung a year later. Yeah. So all the efforts he has put in for the last 1 year just go in vain.
Is there a particular lung cancer case study that left a lasting impression on you? If you're comfortable, could you please share that with us?
So, as I was just mentioning, that in India we have a lot of cancers coming a decade earlier. I think in the last couple of years, I have, unfortunately, I would say, been able to diagnose people who are around 25 to 35 and still had stage 4 lung cancer. I have come across an engineering student who just got into a job, never touched a cigarette. So he was diagnosed with lung cancer, but thanks to targeted therapy, he had a target that we could identify. And it's been a few years, 3 to 4 years already. This was stage 4 I'm talking about. He's going to work just taking a pill a day. And as of today, his lung cancer is under absolute control. We don't know how long we'll be able to keep it under control, but research is growing in such rapid speed. We are able to give a stage 4 lung cancer at least a decade or more, hopefully. But that is the maximum we have hit till now. But probably 5 years down the line, we might find a cure. So that's the hope we are all chasing.
But do you think the age was a factor that helped him recover?
Nothing. It's targeted therapy that we are doing. So even a 70-year-old would have tolerated the treatment as well as a 25-year-old. But the only thing there is he was a never smoker. And the chance of us finding targets is much, much more in a never smoker compared to a smoker. A smoker usually won't respond to targeted therapy. Not all, but by convention, targets are usually found in non-smokers, especially women of Asian descent and less than 50. So these are the subgroups where we really search for targets. And now diagnostics have become such an important role. It's become precision medicine in lung cancer. So every person with cancer, we tend to study their genome at such a level that we are able to identify the targets. It's going to be a tailored therapy in the next decade rather than a blanket therapy for all.
So lastly, I want to end by asking you, do lifestyle and dietary adjustments help with preventing lung cancer?
Yes, I think not only lung cancer, I think lifestyle and diet affects literally every cancer in the body. I think more and more our physical activity is coming down, and a lot of fast food has crept in, and all of us are culprits in indulging in that once in a while. So I think regular exercise and eating nutritious food, including a lot of green leafy vegetables, definitely plays a role in increasing our body's ability to fight many cancers. I wouldn't put it at only lung cancer, but many cancers, our fighting mechanism against these fast growing cells is much better when we have a healthy immunity, which again is regulated by diet and physical activity.
Okay, thank you so much for joining us. It was a pleasure to have you here. Very informative. And thank you guys so much for watching. We'll be back with another episode of Voice for Lungs.